and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Recently, the government removed liquid nicotine from the poisons list of controlled substances as part of a move to tax its use of in vapes and e-cigarettes. Now, what are the implications of such a move? Joining me now is Associate Professor Dr. Nur Amani Ahmad Tajuddin. She is a family medicine consultant and deputy coordinator of the Nicotine Addiction Research and Collaborating Group under Universiti Malaya's Faculty of Medicine. Dr. Amani, thank you so much for joining me on the show today. Can I begin our conversation today by asking you to lay out for us what your concerns are when it comes to the exemption of liquid and gel nicotine from the Poisons Act?
Okay, thank you, Melisa. Firstly, I think we need to understand what nicotine itself is. It is a poison and it belongs to Class C poison. And nicotine is registered under Drugs and Cosmetics Control Regulations 1984. So, its sale currently, if it's taken out of the Poisons Act, it means that it can be sold openly in the open market. Okay, but before this, the nicotine, its sale and supply can only be made through licensed pharmacists and also registered medical practitioners. So what does this imply? It implies that it can be sold to anyone, including kids and teenagers. Okay, and the worry is that it's a chain effect. If you take out one substance which is poisonous from the Poisons Act, what about other substances? There will be other industries and people calling out to get other kinds of poisons out from this act. So this is our main worry. And also, when it can be sold freely in the market, does this also mean that they can also advertise this freely, even more freely compared to before? So this is our concern.
Okay, so help me understand. This is for liquid and gel nicotine, right? And this can be used in vape and e-cigarettes. I'm trying to understand the differences between the regulations for vape and e-cigarettes versus, say, more traditional tobacco products. With the declassification of liquid nicotine, what does that mean? Does that mean that now everyone can buy, all people can buy nicotine products, including that in cigarettes?
Yes, okay. So to make it simple, okay, the conventional cigarette, it is actually regulated, and it is regulated if it is under the Food Act 1983. Okay, so and under this regulation, the conventional cigarette cannot be sold openly. It has got specific requirements. For example, there must be a warning label at the front and at the back. How many percentage of the warning label must it cover from the front and the back? What is the font size of the cigarette box? And also how many cigarettes per box can you sell? And also the price is being regulated per box. Now, it does not apply at the moment for nicotine containing vape products or electronic cigarettes. So at the moment, there is no regulation. Okay. Previously, we were told that it cannot be sold to young adults. So when we are talking about young adults, it means children and teenagers. However, with this regulation, nobody actually monitors it. All right. So with nicotine being put out from the Poisons Act, so that is our main worry.
Can you tell me a bit about the amount? How much is in, say, a traditional cigarette versus vaping or e-cigarettes? I mean, what are the health effects of that amount of nicotine in those devices?
Okay, when we talk about nicotine alone, okay, nicotine itself is disastrous. So nicotine actually when it sits into on our receptors in our brain, what it does is actually releases dopamine. Dopamine in our brain is a happy hormone. Okay, so when a person inhales nicotine, either from conventional cigarette or from a vaping product, the nicotine gets to our receptor very fast, just within a few seconds. So when this nicotine effect in our brain is weaned off from our receptors, this dopamine level is also reduced. When it's reduced, there will be signal in our brain to tell us that the smoker or the vapor needs to take the next cigarette or the next vape to replace or to top up the nicotine in our receptor. So what it does is that actually stroke risk is increased. Okay, from nicotine alone, I'm not talking about other chemicals yet. It increases the heart rate and also our blood pressure. In the long term, it can cause deposition of cholesterol in our blood vessel, eventually causing heart attack, or we call it myocardial infarction, or even stroke if it compromises the blood vessel going to our brain. It also can cause cancer risk in the oral cavity, in the larynx and throat. And there has been report or concerns among dentists itself that among teenagers who vape or take e-cigarette, they foresee that they will be seeing earlier cases of oropharyngeal cancers among younger people in the next probably 5 to 15 years to come. Okay, other than that, from the nicotine itself, it can increase the respiratory rate, cause lung cancer, and also conditions called chronic obstructive pulmonary disease. Or it can also cause diabetes or pancreatic cancer. Among male, it can cause impotence. Okay, it's very important for male. Yeah? It can cause impotence or erectile dysfunction. And important for teenagers and female who vape, it can also cause premature wrinkling of the skin. So what it means is that it causes premature aging of the skin.
Aging.
So a person who smoke either conventional cigarette or vaping products, they can look older compared to their friends who are of their same age. Okay, so that is, we are talking about nicotine alone, yeah. But if you are talking about the whole e-cigarette content, it has got heavy metals. Okay, so what these heavy metals can do is actually reduce our kidney function, and in the long run, causing kidney failure. Okay, it can also worsen someone's asthma, causing people to have pneumonia. All right, causing people to have a gum problem, like periodontitis. It can also affect our DNA and also reproductive system. And also it can cause liver toxicity and also what we call hemolytic anemia, just from this heavy metals alone. So these heavy metals is actually nickel, chromium, plumbum, aluminium, cadmium, mangan. So those are among the heavy metals present in vaping products.
So medical experts have long established the dangers of nicotine. And now we know the dangers of the other chemicals associated with vape products. There are those who say, well, the government's move will actually allow for greater regulation of vape. They say that the Poisons Act was actually an unsuitable framework to regulate vape products. I'm wondering, Dr. Amani, what do you think about that? What would you like to see in terms of regulation for vape products?
Okay, I disagree with that, because even with the nicotine still under the Poisons Act, the e-cigarette or vaping devices or the products can still be regulated. There is no reason to take out the nicotine out from the the Poisons Act, because other products, other poisons can still be regulated when it still belongs under the Poisons Act. So why is there a rush to take out nicotine from Poisons Act and putting it into the Food Act? Because when we do programs at school, okay, we do talk a bit about this Food Act and the contents of e-cigarette, which contains the flavorings and the colorings, which is actually when it falls under the Food Act, when it enters our digestive system, it is actually quite safe, okay, but when it goes into the Food Act and the general public will assume that, oh, when it falls under the Food Act, it means that it is safe for us to consume. Does not matter whether we consume it orally or by inhalation. We must be aware that there has been report by our National Poison Center that is based in USM that a toddler, an infant actually, as young as 3 months old, was intoxicated by this e-juice, this the e-cigarette juice. Okay, so there is no logical reasoning behind getting nicotine out from the Poisons Act just to regulate it, because you have not even thought about the regulation, but you take out nicotine itself first before you have even have the regulation. So it is something that is uncalled for.
Dr. Amani, thank you so much for laying out all the dangers of nicotine for us. We appreciate your time. Thank you for being on the show. That was Dr. Nur Amani Ahmad Tajuddin, Deputy Coordinator of the Nicotine Addiction Research and Collaborating Group. We're going to take a quick break here and consider this. We will be back with more. Stay tuned. Hello, welcome back to Consider This. I'm Melisa Idris. Let's continue our discussion about the impact of the government's decision to remove liquid nicotine from the poisons list of controlled substances. The move paves the way for excise taxes to be imposed on nicotine formulations, but it also effectively makes it possible for vape and e-cigarette products to now be bought and sold over the counter with no restrictions. Joining me now is Sulastri Samsudin. She is a chief pharmacist at the National Poison Center, which provides toxicological information and poison management to healthcare providers and the general public. Sulastri, thank you so much for joining me on the show today. Can we very quickly begin by you stating what the National Poison Center's position is when it comes to this decision to exempt liquid and gel nicotine from the Poisons Act?
Okay, thank you, Melisa. So this is a very important question, and to answer this question, let me begin with the definition of a poison, because we are from the Poison Center, right? So what is poison? Simply put, a poison is actually any substance that can cause harm to the body, right? And then we know that studies have shown nicotine use can lead to many diseases. It can cause cardiovascular diseases, lung diseases, or even cancer. And nicotine is not only harmful, nicotine also is a highly addictive substance. So, for us, nicotine is still considered as a poison regardless of its current legal classification. Whether it has been exempted or not from the Poison Act, nicotine use still poses significant health risks. So bear in mind that nicotine is a poison because it is harmful to human health, and even worse, it is also highly addictive substance. Imagine what happens when we have this combination in a product. You will get a loyal customer for the vape industry and a nicotine addict who will continue using the product despite knowing the harmful effect that they may get. And actually, this is actually one of the criteria for nicotine dependency. And Melisa, nicotine dependent is actually a type of mental and behavioral related disease. It's a disease, and it's recognized through the International Statistical Classification of Disease, ICD-10. Okay, so that means a person who suffer from dependence on on nicotine is actually a mental health patient who need treatment. That's why we have the quit smoking clinic, right? That's why we have the quit smoking clinic. And that quit smoking clinic actually is to treat nicotine dependent, not just to quit smoking habit. So we must understand that that is the problem that we have now. People think that they want to quit smoking and they start vaping, but we actually want to stop them from nicotine addiction.
Okay. All right. So help me understand nicotine or gel, liquid and gel nicotine was previously a Class C substance on the poisons list. Help me understand what that is, the context of a poison being classified as Class C. What are the restrictions, the controls that are placed on such substances?
Okay. To understand, to answer this, actually, we need to understand what is the Poison Act, right? So the Poison Act 1952 was established to protect the public from the danger of the hazardous substance, and this include nicotine. So under Poison Act, it regulates the importation, the possession, manufacture, the compounding, the storage, transport, sales, and also use of the poison. So nicotine previously fell under this purview of the Act, was classified as Group C poison for the purpose of legislation, right? And this mean what? This mean that nicotine and nicotine-containing product under this regulation need to be registered as a medical product first. Then it can only be dispensed by the licensed healthcare practitioner like pharmacist, physician, or dentist only, right? And currently, the only medication registered use in smoking cessation is the nicotine replacement therapy. Have you ever heard about the NRT? They call it as NRT. And nicotine replacement therapy that available in the form of gum or patch, not vape, not e-cigarette, right? So vape has never been approved and registered as smoking cessation aid in Malaysia. That's why nicotine in vape liquid before is not allowed under the Poison Act control. Okay, so that is the restriction. That is why when we don't have this control under the Poison Act, it can easily be sold openly.
Okay, so talk to me about the implications of that, of declassifying liquid and gel nicotine, beyond also just the access issue, right? The access issue, because we're thinking about access now, it's not just physical access, but also online access and and to all ages of society. Can you elaborate a little bit on that?
Yeah, when we talk about the declassifying, or you said it as removing or exemption, right? Of this nicotine gel or liquid from the vape, from the poison list. Obviously, that's mean we are no longer in control legally to prevent or to minimize the harmful effect of nicotine to the Malaysian citizen. Okay, so I would say without the regulation, first, it will allow vape containing nicotine to be sold openly and legally to anyone and include children. This will possibly leading to the new generation of nicotine addict. We know that WHO has warned us the e-cigarette can act as a gateway to children, to adolescents, later to taking up the conventional cigarette. They will end up as a cigarette smoker. And in fact, this has been proven. There's a study in 2019. It is the first report in Asia on 13,000 students in Taiwan and China have shown that teens who are vaping are twice likely to taking up cigarette. This is a study within 2 years' time, and they can see the impact after 2 years' time. Okay, so imagine that during this loophole, the legal loophole time that we are having now, up until the time the tobacco bill passed, but we don't know actually when, right? There may be many more young smokers who have tried vaping legally and they end up become addicted. So that is number one. Number two, there is no control in nicotine level in the vape liquid. Means that it can lead to the high dose of nicotine concentration in a single device. And this will increase the risk of nicotine overdose, especially those among young children. When we have school children try it,
Right.
we have seen it in the social media, the young children, the school children who try, and then you can see that they are vomiting following the first try. That could be the reason from the overdose of nicotine.
Right. Sulastri, are you seeing that with the with the National Poison Centre? Are you observing issues of vape-related poisoning?
Yep. We do not see patient directly. I mean, physically we don't, because actually in the National Poison Center we do have a call center where people, public, anyone, you can call us for consultation for any case of poisoning related cases. So from that call center, we actually receive a poisoning call on vape related exposure, and so we never get any calls pertaining to vape poisoning before the year 2015. Because if you can remember, 2015 was the year where vape start to flood in the Malaysian market and available commercially. And from there on, 2015 until this year, until present, we can see that the trend of vape poisoning is increasing, especially in the last 3 years during the MCO. We have quite a drastic increase during the MCO, and these cases involving children, majority is children, aged less than 5 years old. Because what, during that MCO, when those who smoking, no sorry, when those who are vaping, they stay at home, and they just leave that what do you call it, refill, the e-liquid refill, with the perception that vape is safe. They don't simply practice safe storage, right? They don't keep outreach from the children, and the children, of course, attract by the flavor, by the smell, the odor. So this is the reason why we have a lot of cases involving children during the MCO. But I want to highlight to you, last year we have also seen, we observed that there's a drastic change in terms of the trend of poisoning, where we have more cases involving intentional, means that this is no longer accidental because of the but this is intentional, where involve vapers who try to vape, and who are regular vapor, try to getting the acute effect after the inhalation of the vape. So 1/3 of the cases last year, no, within 2 years time, involving substance abuse. And they start to have agent like magic mushroom. I'm not sure whether you are aware, there's a new, not new, but they try to use it in a new way. Magic mushroom is a hallucinogenic drugs, and which usually people consume through oral or just brew it and drink as tea. But with vaping in the market, they try to experiment, inject and infuse in the vape liquid.
Okay. Sulastri, just very quickly, in the few minutes that we have left, I'm just wondering, what would you like to see then in terms of regulation for nicotine now that it has been exempted from the poisons list?
Oh, for me, even though the damage, I would say the damage has been done, but we as a health practitioner, okay, as health practitioner, we should learn from the history of cigarette smoking. We shouldn't allow vaping since the beginning, but that is not what happening, right? So now what we can urge is to the government to delay the implementation of the excise tax collection, then reinstate back nicotine to the poison list until the new tobacco bill is passed. So please consider this for the sake of our future generation. That would sincerely from me. Okay.
Okay. Yeah. Thank you so much for joining me on the show. I appreciate your time. Thank you.
Thank
that
you.
was Sulastri Samsudin, Chief Pharmacist at the National Poison Centre at USM. And that wraps up this episode of Consider This. I'm Melisa Idris, signing off the evening. Thank you so much for watching, and good night.